Of all the major psychiatric disorders that I treat, from autism to schizophrenia to bipolar, I can share confidently that binge eating disorder is one of the few that 100% recovery. I believe between the nutritional interventions I'm going to share with you this evening, between dietary changes I will share with you this evening, and medications if needed, a binge eating disorder can be resolved, and we can use words like remission and recovery. The reality in mental health and mental illness, we can't always say that. So I tend to start by discussing the problems in my field, but let's just take a medical complaint, maybe something that you've experienced or worried about. Let's say you had a cough and you're worried. Is it COVID? Is it allergies? Is it flu? Is it strep throat? Well, you have the fortunate, whether it's a telehealth appointment or you go to an urgent care or your doctor's office, that you're going to be examined and someone is going to measure the physiology. They're going to look at your O2 sats. They're going to listen to your lungs. They're going to take an X-ray or a blood test, or rapid stress or a PCR. But somehow your physician or practitioner is going to know, is it COVID or is it strep? And based on that diagnosis, they're going to give a treatment, so that anti-physiology treatment. And then as you get better, they'll also measure these same things. Your O2 sats are improving. The lower lobe pneumonia is getting better. And our medical model is a diagnosis and treatment using objective measures, right? As much as we complain about so many aspects of our healthcare system, just think about it. If we didn't have some of these objective measures, we would be guessing. And guess what we do in psychiatry, right? This is myself and my colleagues. We're sitting across from our patients and we're asking a lot of questions. We're getting lists of symptoms. Let's just say you're not sleeping well, you're feeling guilty, you're ruminating, you're sad, you're feeling hopeless, your relationships are falling apart, job is not going well, and you have thoughts of killing yourself. So that list of symptoms in psychiatry will give you a diagnosis. We might say depression, and we're going to give you an anti-symptom treatment, an antidepressant. And we're going to ask you when you come back for a 15-minute med check, how you're doing, how's the mood, any side effects to the medications. There's no concept in psychiatry about what's causing those symptoms, as we discussed in our medical model. And that's the whole core premise of functional psychiatry. What might be contributing? And tonight we'll be talking about binge eating, food addiction, and there are different etiological factors, nutritional, environmental, psychological, dietary, that are all playing a role. But our current psychiatric model doesn't understand or respect those individual differences. So we can't just give an anti-symptom treatment. We don't have an anti-binge treatment. So what I'm urging the community to think about is taking a medical model to binge eating disorders and not blaming our patients and not blaming psychological weaknesses or emotional stresses, that trying to understand that cravings and the inability to control food is a biological phenomenon as opposed to social or environmental factors. And that's the medical model. What's happening in the brain? And so many of my colleagues in the eating disorder world are teaching a mindful eating, and it's just kind of overwhelmingly frustrating to me that the neurochemical basis to binge eating is not addressed, and there are just profound limitations to asking patients to control appetite by meditating or simple behavioral techniques, although can be helpful for many, particularly those with what I refer to as food addiction, which is not everyone with binge eating, it is impossible and just sets up that roller coaster ride for more shame and guilt. So, what are we going to do? First of all, a background on binge eating, it can be diagnosed at any weight. Vast majority are overweight, but a fair number are normal weight. Gender ratio is less skewed than in other eating disorders, so it's closer, male and female, 1.6 to 0.8. Binge eating disorder is actually more common than anorexia and bulimia combined. So binge eating disorder is the most common eating disorder in the United States.